Thanks so much, Deb. It's a wonderful honour to be part of PsyTech 2020. I wish we could all be in Israel together. Such an incredible nation, but it's been a hard year for everyone. And that makes it even more important that these transformational medicines and therapies can be available to people who are suffering. Today, I'm going to be talking about building the ecosystem for psychedelic-assisted therapies in Australia and Asia Pacific, the challenges and opportunities. My husband, Peter Hunt, and I started Mind Medicine Australia at the start of 2019, and it's been quite a roller coaster journey ever since. We first came across the medicines 4.5 years ago through a blog of Tim Ferriss, and then an article of Michael Pollan's, which resonated strongly because it was a story of a Holocaust survivor who was experiencing anxiety and depression after a terminal diagnosis in the New York University trials. And I read this article and I immediately said to Peter, look, I really think we should try this treatment. We all carry trauma, and Peter and I are no exceptions. Peter's father committed suicide when he was 13, and I'm the daughter and granddaughter of Holocaust survivors. Anyway, we attempted to get into trials at Imperial College, but there weren't any for fundamentally healthy participants. And so we set about finding a private guide in the Netherlands and went through a massive psilocybin experience. It was so profound for both of us and affected us both so deeply and on so many levels, improved our relationships with everyone, our families, certainly with one another. Our relationship with nature was significantly heightened, and life has never been the same again, that's for sure. And so as a result of that, we started researching and reading, about this field, meeting some of the researchers themselves and attending some of the conferences and events. A year later, we did another very high dose psilocybin session, even higher dose, with the same therapist, and which was even more profound. And at that point, we said to one another, this is something that needs to be available to all those who are suffering, where it's considered a suitable treatment by the doctor and the patient. And so we set about looking at how we could make that become a possibility in Australia and for this Asia Pacific region. And well, Peter and I are no strangers to setting up charities. We've set up a number of charities over the past couple of decades. In my case, the Song Room, which I founded in 1999 to bring arts learning to disadvantaged children and schools, and has reached nearly 1 million disadvantaged students around Australia, helping improve their educational and social and health outcomes. And then 11 years ago, I set up Creativity Australia and the With One Voice program, which are social inclusion choir programs that bring together haves and have-nots to alleviate loneliness, social isolation, depression, and other mental illnesses. Peter has also been involved in a number of charities and significantly founded the Manly Women's Shelter and Women's Community Shelters, which has set up to support women who are experiencing domestic violence and need safety for their children and for themselves. So once we had realised the enormous need and the efficacy of these medicines and their relative safety as well, we set about founding Mind Medicine Australia. And this has been a really interesting challenge because the scale of the mental health problem in Australia is really enormous. I mean, the Australian mental health statistics are the second worst in the world, only ahead of Iceland, and that was before the COVID pandemic. Now it's anticipated that the mental health statistics in Australia have increased by as much as 25 to 40%. So that's a really huge challenge. So these were the statistics before the COVID pandemic. 1 in 5 Australian adults with a chronic mental illness, 1 in 8 Australians on antidepressants, including 1 in 4 older Australians, and children as young as 5 and 6 being prescribed antidepressants and other psychiatric medications, which of course have lasting effects on cognition. And an estimated 1 in 2 Australians to experience mental illness in their lifetime. Now, sadly, we're seeing really enormous rising rates of mental illness, particularly in Victoria, which has experienced the longest lockdown in the world, where we're seeing rates such as a 33% increase in self-harm by young people, rising rates of suicide and mental illness, which it's really hard to fathom how we're going to treat this significant accelerating crisis unless there's massive innovation in treatments. And that's, of course, what we're all here at PsyTech concerned about, that we want to actually treat the enormous levels of suffering in the community, with, of course, the most common mental illnesses being PTSD, anxiety disorders, depression, and substance use disorders. In Australia, of course, we also have an enormous veterans and first responders population who have a much higher incidence of depression and substance abuse and suicidal ideation than the normal population. And there's an enormous need to provide solutions to that particular patient cohort, as well as other patient cohorts, which also have a high incidence of mental illness, including everyone from veterinarians to lawyers. Of course, there's a massive impact on sufferers, families and carers of those who are experiencing mental illness, and the rates of unemployment increase significantly as a result of mental illness. And of course, there's a massive correlation between natural disasters and mental illness. And many of you will recall that we also had a significant bushfire crisis in Australia early in 2020. And there's still an enormous amount of mental illness coming out of that particular disaster as well. And mental illness is a primary cause of both suicide and homelessness. The total cost of mental illness and suicide to the Australian economy before COVID and before the bushfires was estimated at $180 billion per year. And of course, there's been no improvement in treatment outcomes over the past 50 years. Only 35% of sufferers experience remission from pharmacotherapy or psychotherapy. And of course, we're seeing significant relapses after treatment stops. And though patients may experience some kind of response from these medications, that's not equivalent to remission. There are also common side effects of antidepressants, and they'd be well known to everyone. In the case of PTSD, the remission rates are even lower. So it's clear that a more of the same approach is not going to solve the problem that we're facing. So when we set up Mind Medicine Australia, our goal was to help alleviate the suffering caused by mental illness in Australia through expanding the treatment options available to medical practitioners and their patients, through establishment of safe and effective psychedelic-assisted treatments for a range of mental illnesses. Our focus so far has largely been on psilocybin and MDMA, as they're the two medicines which are most advanced in the FDA trials and have breakthrough therapy status. But we're also interested in other psychedelics, including ketamine, ibogaine, ayahuasca, and DMT. Our indication of success for Mind Medicine Australia is that these therapies become an integral part of our mental health system, that they achieve high remission rates, leading to a substantial improvement in our mental health statistics, so that these curative medicines actually help to ensure that patients don't have a life sentence of mental illness in the majority of cases, and that they're seen as the curative medicines that they are, rather than palliative treatments which just manage the condition for people's, often in their entire lives. And a significant part of our strategy is ensuring that these medicines are accessible and affordable to all Australians in need, regardless of where they're based. Of course, we have a very large country here, so we need to look at the geographic availability of these medicines as well. So we've put together the strongest board that we possibly could, and you'll see there my husband, who's an ex-investment banker, and both of us are philanthropists and social entrepreneurs. We also have the former head of the armed forces. We have the head of mental health at Swinburne Uni. We have a wonderful psychiatrist, Dr. Eli Kotler, who's committed to addiction and finding new treatments for treating addiction. Dr. Simon Longstaff, who's the head of the Ethics Centre, who says it's unethical for these treatments not to be available to patients who are suffering in Australia in medically controlled environments. Mono, who's a lawyer, Andrew, the former Trade Minister for Australia, and Nicholas, who's an entrepreneur and investment banker. We've also put together a wonderful team, and you can see there Ilan Heyman, who's our head of operations, Renee Harvey, who we've brought from Imperial College, who worked on the psilocybin trials with Robin Carhart-Harris and worked with David Nutt and others. And she's designing the psychedelic therapy training program, which I'll speak further about. And then we have a wonderful other team, including Alana Voy, who's a wonderful clinical psychologist, and Melissa Warner, who's also well known in the psychedelic space. We also are very grateful to our ambassadors, Rick Doblin, David Nutt, Ben Sessa, and Roland Griffiths, who've all been extremely supportive. And then we have an enormous advisory panel that consists of psychiatrists, and there you can see a number of the psychiatrists involved with our work, and there's many others, and then other medical practitioners, psychologists, behavioural scientists, pharmacologists, religious leaders, and we consider those very important because, of course, we're having a lot of religious leaders approach us about the increasing rates of mental illness in their communities. And then lawyers, natural medicine people, and people across all relevant disciplines, including the wonderful Wade Davis, you can see there, the wonderful anthropologist, and people like Dr. Thomas Pogge and others. So our strategy is four-pronged. The first part of our strategy in building the ecosystem is really increasing awareness and knowledge around these medicines, getting people up the curve. And so we focus on holding a number of educational events, webinars, screenings of documentaries such as Trip of Compassion, the wonderful Israeli documentary, and Fantastic Fungi, and others in that category. We are also planning a major international medical summit in November 2021. It was, of course, originally this year in November, but we had to move it due to the pandemic. And we've confirmed a number of the leading researchers and scientists and doctors in this space globally. I'll come to that shortly. We also have started state and regional chapters. We have over 25 chapters in Australia and New Zealand. And the reason for that is, you know, we're a pretty small organisation and we can't do this all on our own. And so we feel it's really important to build the capacity and empower leaders across all sectors locally to start up chapters and to really work with their local communities to educate and inform them about these medicines, to work with their local media and their local members of parliament and others, so that we really have a grassroots movement that's building all around Australia and New Zealand. As I mentioned earlier, we brought Renee Harvey from Imperial College to develop the very first certificate in psychedelic-assisted therapies in the Southern Hemisphere. And so that will be a part-time course. It's a 90-hour course that takes place over 4 months. There'll be face-to-face components and online components. And I'm really pleased to say that our first intake in January is fully subscribed. We're on a wait list now, and our second intake, which starts in July, is pretty nearly full as well. So we have a mix of psychiatrists, psychologists, drug and alcohol specialists, mental health nurses, psychotherapists, GPs, and other physicians, occupational therapists, and social workers signed up to undertake that training. And again, we have a number of the leading researchers and psychiatrists and medical practitioners who will be leading that training along with local practitioners here in Australia. In addition to that, we're looking at setting up an Asia Pacific Centre for Emerging Mental Health Therapies in partnership with universities in Australia to undertake applied research and development. Also look at the supply chains and agribusiness to look at ways in which these medicines can be grown and manufactured in Australia, and to look at ways that we can also really measure and analyse how important it is to use medicines such as these, which offer cost savings across the life of a patient's life versus the current existing treatments. We're also very committed to establishing preferred legal and ethical frameworks. So we're working with Dr. Simon Longstaff and other international lawyers to look at these ethical frameworks and also the legal framework. So many of you will be aware that we've recently put in applications to reschedule both MDMA and psilocybin. And if these go through, then Australia will be one of the first countries in the world to actually reschedule these substances from prohibited drugs to controlled medicines. So fingers are crossed and toes are crossed as well. And we were personally sent hundreds of submissions from doctors and patients supporting the rescheduling of these medicines. And many of these letters were heartbreaking. Myself and our staff were in tears reading a lot of the letters, seeing the desperation of patients and also the medical professionals who are trying to help them, and the lack of treatments and the struggles that many patients have had with the current treatments, which have not been helpful for many of them. So if we can help alleviate some of that suffering, what a wonderful gift that would be. We've also set up a psychological support service to provide a range of support services to people in the community who are using these medicines. So whilst we don't condone recreational use of these medicines, we absolutely accept that people are using these medicines and often with the best intentions. And we provide integration and other support services to patients, and also provide back-end support to GPs and other medical practitioners who don't know how to heal patients who are using those sorts of medicines. We're also looking at a rollout strategy with a range of clinics around Australia to make sure that these medicines can become available in clinical environments under the right supervision as soon as possible. We should also mention that in Australia recently, we've had a number of psychiatrists and general practitioners receive approvals through the SASB scheme, which is an expanded access scheme that's available to doctors and their patients where multiple treatments have been trialled and the patient is treatment resistant and in danger. And we've had a number of approvals for both psilocybin and MDMA treatments to be conducted in Australia for those patients. So that's also quite historic for Australia. Again, just reiterating the point that our focus is wholly clinical. We're not advocating for patients to be able to take these medicines home. So here's some of this summary. So we have submitted these first applications to the TGA, which is our regulator, to reschedule psilocybin and MDMA so that they can be more accessible as clinical medicines for the treatment of key mental illnesses. This will also help to make sure that these medicines can be available for additional trials and research. And again, that point too around the SASB scheme that I just mentioned. The rescheduling will move these medicines from Schedule 9 to Schedule 8. If it's successful, yes, Australia will become the first country in the world to reschedule these substances for their therapeutic potential. Wouldn't that be wonderful? And we hope that that will help many others to follow suit. So keeping those fingers and toes crossed. I love this quote of Tim Ferriss, who says, you know, he views the next 5 years as an absolutely golden opportunity. There's an opportunity to use a relatively small amount of money to have billions of dollars of impact in terms of helping heal people with mental illnesses and to help affect millions of lives. This is really why Peter and myself are dedicating pretty much all of our time and significant amount of our wealth to this movement. We want to help as many people as possible to get access to these treatments. We have no other interest. We have no profit motive. We simply want to help those who are suffering. And sadly, we hear from those people every day in the form of text messages, letters, emails, and calls. And it truly is heartbreaking when you hear the levels of suffering, which I'm sure we all hear about regularly, and we owe it to those who've tried everything to make sure that these treatments can become available as soon as possible. How you can help? Start conversations, and I'm sure all of you on, watching this summit will be talking about these medicines and talking about the sessions that you're seeing and just sharing as much as you can what's going on in this space. Wherever possible, we encourage you to be philanthropic as well. Both small and large donations make an enormous difference in a movement of this kind. And you may think that you don't have enough resources to help, but all types of resources help, not just money. You can volunteer, you can join our chapters, and you can, of course, support all of the wonderful organisations who are speaking at this summit. We have a wonderful Learn section on our website, and we encourage you to go on there. But talk to your doctors and medical professionals and your local members of parliament, because I always say to people, it's doctor by doctor, member of parliament by member of parliament, human being by human being. We just have to educate everyone about these medicines so that we can remove the stigma that still remains when these medicines were politicised back in the 1970s. And we need to remind people, as Professor David Nutt famously says, that we've got this lost 50 years, this censorship of these medicines, which he says is the greatest censorship of medicine and science in the history of humanity. And we owe it to humanity to make sure that these medicines can become available now through a range of different methods, and to continue to research in this space, because these medicines could have such a vast impact on a range of conditions. And please follow us on social media and so on, and attend our events. We have a wonderful free webinar program going on at the moment as well, and we'll show you some of those webinars later as well. So this is a certificate in psychedelic-assisted therapies, and we encourage those of you who are on the call in this part of the world, in Asia or New Zealand or Australia, to apply. And if you can't get into the first intake because it's full, then try for the second one and we can put you on a wait list. But we encourage you to add this particular skill to your capabilities and skills so that you can work in this space, because it's a rapidly emerging field, as you all know. This is the psychological support services information. And again, if you need some further support in this space, reach out to us. And this is our International Summit on Psychedelic-Assisted Therapies for Mental Illness, which will take place in November 2021. And we encourage you all to join us for that. It's going to be an in-person event, and we welcome you all to Melbourne and Australia, a fantastic country. And by then, of course, we hope that there'll be more capacity for people to move freely around and to come to Australia and join us at that. So with that in mind, we encourage you all to jump on our webinars. We've got some fantastic webinars coming up. And also to share our animated video, which we showed at the start of this talk. Please share that widely and spread the word about Mind Medicine Australia. Thank you so much, ladies and gentlemen, and thanks for your support of this critical space. Together, we can help millions who are suffering. to access these medicines. So thank you for all the work that all of you do in this space. It means so much to everyone. Thank you.